Senator Harry Reid, the Democratic leader, came out Tuesday night, seemed to announce that there was an agreement, an emerging agreement among the 60 Democratic senators that would involve dropping the public option, replacing it with allowing most Americans who don't have health insurance from their employers to buy into something like the Members of Congress plan, and also a Medicare buy-in for people 55 to 64. But by the end of the week, there was an awful lot of confusion on the Senate floor.
Right now, no member on this side has any idea as to the specifics of the proposal that the majority leader, I understand, has sent to OMB for some kind of scoring.
I would say to the senator from Arizona that I'm in the dark almost as much as he is, and I'm in the leadership.
The number 2 Democrat in the Senate, George Will.
Well, the public option this week receded and was replaced by a public option on steroids, which is the buy-in on the part of 34 million Americans between age 55 and 64, only 3 million of whom, about 4 million, are uninsured. George, there are 3 basic political numbers that we ought to look at from this week. CNN poll, 61% oppose the plan, 36% favor it. Second, today there are more independents in America than there are members of either party. And the independents are more hostile to Congress. Their approval rating of Congress is 14%, below the Republicans, which is 17%. Third, there was a state Senate race in Kentucky this week. They nationalized it. It was in a heavily Democratic district. The Republican was heavily outspent. He'd made this a referendum on Pelosi, Reid, and health care. The Republican won by 12%.